Jai Gurudev, Namaste. Myself Dr. Dibyajyoti Moharana, working as an assistant professor in Department of Panchakarma, Shri Shri College of Ayurvedic Science and Research, Shri Shri Hospital, Shri Shri University, Cuttack, Orissa. So today's topic of discussion is detox with Panchakarma. So is there any reference of detox available in Ayurveda? Yes, definitely yes. So Ayurveda has a unique detox speciality known as Panchakarma. So the reference goes like this: Vamanam rechanam nasyam niruhascha anuvasanam etani panchakarmani kathitani munishware. So the Rishi Munis or the saints have mentioned Panchakarma as Vamana, Virechana, Nasya, Niruvavasti, Anuvasana Basti and Nasya Karma. So Vamana is nothing but therapeutic emesis, that is a therapeutic vomiting method that is indicated in diseases like Kasa, Swasa, Kushta Roga, Tvachajanya Roga, etc. And so Virechana, which is known as therapeutic purgation, it is indicated in some disease like Kushta, Tvachajanya Vikara, fungal infections, dermatitis, eczema, psoriasis, etc. Then there is a procedure known as Basti, which is enema therapy, that is indicated in Vayu related Vikara or Vata related Vikara like osteoarthritis. It is also indicated in Amavata, condition of hyperuricemia or elevation of uric acid. Then also we are practicing the Basti Chikitsa in condition of paralysis, hemiplegia, paraplegia, quadriplegia, ardhita, etc. And there is a procedure known as Nasya, which is indicated in Jatrurdha Pradesha Vikara like the disease of head, disease of nose, disease above the clavicle like migraine, etc. So we have a unique detox procedure, that is Rakta Mukshana, which is bloodletting, that consists of Siraveda. Siraveda is nothing but venipuncture or venesection. Then there is a procedure known as Jalauka Vacharana, that is medicated leech therapy, where we are utilizing Hirudo medicinalis as a medicinal leech to induce the detox in some of the diseases like fungal infection, Dadru Mandala Kushta, and some of the condition of eczema, some of the condition of dermatitis, psoriasis, etc. So I request all of you to come to our Ayurveda hospital and to take the benefit of such Panchakarma therapies.